We do not always appreciate the importance of our health until we lose it. When we are told that nothing can be done to heal us, no matter how much money we have, everything that seems so important before now starts to lose its value. We experience pain, desperation, and loneliness in the presence of others. Then we acknowledge that healing is a gift that goes beyond medicine, that there are other options out there that may help us, and that there is a higher power that controls the distribution of this gift. As a result, we hesitantly and somewhat reluctantly begin to explore these other avenues. To our great surprise, we discover the secrets of the universe through alternative medicine. We experience and respect the generosity of divinity through various health modalities. Our faith is restored, our health improves, and life begins to make sense again. Health is a basic human right. And healing is a gift that is given to us by God through a variety of channels, including doctors and other alternative practitioners. How is it that until now we did not know that there was so much on offer? That doesn't really matter, for now we are being given the chance to know.
Welcome to episode 13 of our show. I cannot believe that we're already on episode 13. It's just amazing how time flies. There are many illnesses which most people have accepted as part of their health ailments. Like we mentioned in our last show, constipation is one of those. There is another one which ranks high in the list, and that is stomach ulcers. We touched on ulcers in the last show, and that seems to have triggered a lot of interest. What I like about this show is that it gives a chance for people to understand better about health matters, and we really appreciate the feedback that we get from many of you. Today we are talking about stomach ulcers. I am sure many of us know about someone who suffers from too much stomach acid, or who have got ulcers, or who is perhaps using antacids, or maybe we are one of those people. Antacids are a huge rand or dollar industry, and there is a huge demand for it that keeps growing and growing. The pharmaceutical companies are even adding or revising the products that deal with this condition because the demand is just overwhelming. We will do our best to give information on stomach ulcers in today's show, and enjoy the show.
Health Haven is taking the health industry by storm. They are the talk of the town because they do the unthinkable and the unprecedented. How do you take someone in Miss Sinovillo's condition, who has been in this position for years, someone who is completely disabled, and promise to get her well again? You can only do that if you are sure of what you are doing. That is what defines Health Haven. They have the gift of healing, and they know what they are doing.
Have you ever taken time to look at the lifestyle that black people lived in rural areas in the past 40, 50, 60 years ago? They lived on what we call today organic produce, and which is actually very expensive, and most of people cannot afford it. But it's kind of ironic that this is the kind of lifestyle that was enjoyed by these people in the past years. Now, what does organic produce mean? It means free-range chickens. You know, those chickens that are roaming around freely, and not like kept in foul runs and cannot even move at their freedom. It means free-range eggs. It means free-range cattle. Cattle, well, maybe not free-range, but organic cattle that eat proper natural produce. So it just a whole range. It just covers a whole range of food that is produced organically, which means in its natural state, and that is the healthiest of food. You know what stood out in this lifestyle is their health. You would never find an obese person. You would never find people that were suffering from all these lifestyle illnesses like diabetes, blood pressure. You would actually be shocked at how much longevity they enjoyed in those years. Their health actually got crippled when they changed their lifestyle and copied the urban lifestyle. So what does this mean? It means we exchanged something of real value for what we thought is best. And a classical example of that is like our historical anecdote where we had that, well, I'm not actually trying to be political, I'm just throwing a bit of a light on the story, that we actually thought that a silver teaspoon has got more value, and we're willing to exchange it for a full cow, because it was something that was glittering and looked good, and yet it carried no value as compared to a cow. But that was our confusion and our misunderstanding then. That is exactly what we have done with our health. We have exchanged our lifestyle for something that is killing us very, very slowly, and we are paying a huge price with our health. And politik between, no, I'm just triggering your thinking cap so that we can see where we're coming from, where we are, and where we are going with the change of lifestyle that we have had to adopt. Stomach ulcers are a lifestyle illness. As usual, I've invited Carol, who you know by now, to sort of help me or help us to discuss the question of stomach ulcers, particularly your questions that you raised with her, and the concerns or the request for more information. So that is why we've got her today again. Hi, Carol.
Hi.
How are you?
Good, thank you.
Cool. Okay. Let's just get down to it.
On the subject of stomach ulcers, the more we actually hear people speak about it, they just seem to have taken it for granted that stomach ulcers is a part of life. And they're so accepting of this. I mean, you hear people saying, oh no, I've had one for years and it's due to stress, and no one actually really addresses the problems and the causes. They just take their antacids and they just carry on. Why do you think they become so receptive to this and accepting of it?
Well, okay, that's now my opinion. I think it's actually, when you suffer from something and you go to a practitioner and they tell you that this is what is going to help you, but this is never really going to take this away from you. And they even say we now have to put you on chronic medication for this type of illness. You don't have a choice. You just have to accept that this is it. Because I don't think, people would want to sit with ulcers. No one would want to sit with any illness for that matter. But when you know that this is just your fate, there is nothing that can actually make you do away with this completely. You just have to keep on managing the symptom. I suppose maybe it's just their way of coping, that you just have to.
But it sounds so familiar when you said now about chronic medication. I mean, I know so many people that are on chronic medication for high blood pressure, for cholesterol, for gout, for certain things, and people just accept this and just take these medicines for the rest of their lives. So it'd be so nice.
And even believe that there is nothing that's,
they're so accepting of that. So in actual fact, all they're doing is treating symptom and never ever getting to the cause and how to actually properly diagnose and to eliminate these symptoms.
Well, I think to some extent maybe we cannot blame them, Carol,
Sure.
because like I say, if you don't have any other option, because like for instance, like if you see the amount of interest that has been generated by this show,
Absolutely.
it's really phenomenal, because people are saying now for the first time we're starting to understand what it means when you've got this illness, what it means, what may be causing it, and what options are available to help us deal with it. So I think to a great extent it's not because they want to live with this condition or accept it, but it's because there is no other alternative that is supplied to them, so that they can actually try that and see if it doesn't change their life for the better. And that is why we're making such a huge impact.
Yes.
It's because we're giving people an opportunity to make such choices. We're not saying we're the only section of or part of health. We say conventional has got a huge part to play, but we're saying there is so much more than just what is offered by conventional medicine. So, but because people didn't have the information, we are now made the first step in providing that information. There may be a whole lot of other developments that may emerge that will give people even bigger choices. But it's actually quite exciting for us to know that we're making such a good contribution, and we really appreciate the feedback. So to come to that, therefore, I think it's because people didn't know that there was so much more that
uninformed.
is uninformed. It was a question of information. So that would my a response to why does it look like people have just accepted it as a way of life. Okay.
All right. What is an ulcer? Because when I think of an ulcer, I think of a weeping wound on the outside of your leg or arm that it actually really you wouldn't actually want it inside your body, but that's what I think when I think of an ulcer. So what causes it and how do we treat this?
Well, it's exactly what you're saying. Ulcer is an ulcer. So it's a wound. It's a tissue that's broken, which is unhealthy, which needs healing, which needs repairing. So what you see on the outside as ulcer is what also it's a slonda. Basically in Xhosa or Zulu is slonda. It's a wound.
A weeping wound. But it seems so much more acceptable. You can't see it. Because the inside is not visible, so if you can't see it, then it's not as bad as what it would be if you could see it on the outside. And that's scary.
It really is like that. And also maybe the fact that you do get something that sort of take away the pain. You tend to forget about it. That is how serious it is. So it is basically what ulcer is a wound. It's tissue that has been broken and that is open. which is not supposed to be broken. It's supposed to be sealed, to be covered properly, but it's a tissue that's open. But stomach ulcers, which is what we're talking about today, it's that type of wound in your gastric area, in your stomach. It may be in your esophagus, it may be in your small intestine, but it is a broken tissue. That is what it is. Now, there are many causes for stomach ulcers, but because of time constraints, I will just limit my answer to the most, not really just common only, but to the most that people are unaware of. Because people always, well, I've got ulcer because I've got too much acid. But that's the common knowledge, that if you've got ulcer, that means you've got too much acid. And yet that is not the case, although it does, all the time. So I will just limit my answer to three causes. The first one is actually a bacteria. I did touch on it when we were talking about constipation. There is a bacteria which is called Helicobacter pylori bacteria. I will actually show a footage of the bacteria, because maybe when people see it moving, that it actually is a real chocho, then they will realize that it's not a joke. So it's a bacteria that sits in the stomach. You may get it. It's an infectious type of. It causes the infection. It breaks the tissues because it actually eats on that stomach lining. And remember, the stomach lining is protected from acid naturally. It's got a whole lot of mucus around it that protects so that the acid doesn't penetrate and actually eats on the lining itself, on the tissue itself. But when you've got Helicobacter, it actually penetrates that mucus and eats on the stomach lining and cause a sore, and breaks that tissue. Now, the Helicobacter pylori breeds in the gastric area. That's where it sits. That's where it lives. That's where it thrives. But what happens is, because of hydrochloric acid, which is the acid in our stomachs that helps to digest food, like I said in the past, that acid does not only digest food. It destroys bacteria like that, like Helicobacter pylori. It destroys a bacteria like Candida. But now, when you have got a low stomach acid, it gets a chance to thrive in your stomach. Because remember, once you're lucky enough for them to discover when they test that you actually are infected by a Helicobacter, they will give you antibiotics. But you've got a natural ability of destroying Helicobacter pylori by having a good pH of the stomach acid, which is the other reason why people have a stomach ulcer. Because besides the Helicobacter, now if you've got a low stomach acid, because remember, like I said in our last show when we were talking about constipation, I said the stomach acid is very, very important, that you must have the right pH of that stomach acid. It must be very, very acidic, because it must break down food. It must destroy those bacteria. It must destroy the Candida. It must break down protein, because remember, protein is hard for your stomach to digest. So you need a good acidic hydrochloric acid in order to break down a protein, and you need that protein to repair a broken tissue, to repair that cell, and heal that ulcer. So when you've got a low stomach acid, therefore, that means you are not in a position to destroy the Helicobacter pylori, so it's going to eat on your stomach lining and cause you to have an ulcer. And then on the other hand, because the acid is low, you are not in a position to properly digest protein, which you need in order to repair that ulcer. And therefore, that ulcer, because it's open, and remember, the stomach acid is its place. So you cannot get rid of stomach acid. It's got to be there. That's where it belongs. So because now we've got a broken tissue, that acid is going to eat on you. It's really going to chow on that ulcer, which is why most people with stomach ulcers, you find they never really get rid of it. They just get manage the pain, they get relief, and then you find somehow, and then it gets it's bleeding, and then you find then it becomes stomach cancer and all that. So it complicates into other illnesses. So you need a good pH of your stomach acid, which is therefore the second reason why people have ulcers. When you've got a low stomach acid, you are very susceptible to having ulcers because of these reasons that I've mentioned above. But the third thing that causes stomach ulcer is a condition called gastrinoma. Now, gastrinoma is a tumor that actually develops in either the pancreas or the duodenum, which is the first portion of your stomach, of your small intestines. Now, what happens is gastrin is a hormone that is used in the stomach. It helps with the digestion. It actually forms part of hydrochloric acid. And it's very important for your digestive system. That is the gastric acid that we always talk about. Now, but that gastric acid must be within limits. It must not be, you must not get too much of it. But the body system or the digestive system is in a position of regulating that. But when you've got gastrinoma, that means you've got a tumor, and that tumor actually causes you to produce too much of gastrin and to supply too much of that gastrin to your stomach. And then the problem is once you have too much of that, then it starts to eat on you, because then that acid is not controlled, is not regulated. So you've got too much of it, then it also eats on your stomach. So you find those people, so in other words, you end up having an over, at which you have what is called hyperchloridria now. Now remember, hypo is when it's low, but hyper it's when it's too much, So that's the other reason why people tend to have ulcer. But now remember, gastrinoma is not only just a duodenal problem, it's a pancreatic problem. So you may have tumors in your pancreas, which may end up causing you to have ulcer in your stomach, and you may not even link them. You may not even combine them. So I'm going to limit out our causes today just to those two, because they are huge in causing stomach ulcers. And yet we don't even understand. We just think, it's too much stomach acid. We need to understand that, because once you have something that messes up that pancreas, you're not just dealing with pancreatic related problems of diabetes or pancreatic cancer or insulinoma or pancreatitis or cystic, but you end up having problems that will affect you in the stomach, and you may not even know that there are linkages there. So that is why it is so important to understand how the body systems work together, because, and that's why you find that for adult even, when we treat you, we will not just treat the stomach ulcer, we will establish what is causing you to have stomach ulcer in your cases. Have you got gastrinoma? Or have you got an infection of Helicobacter pylori? Or is it your pH of your stomach acid too low? Because then we will deal with those. But then if it's pancreatic related, you'll find we have to deal with the pancreas as well, establish what's causing damage to your pancreas and deal with that as well. So that's why you find that we end up giving people quite a number of protocols, because we work with different systems of the body, but in synergy. So that's what causes the causes that are limited to in our discussion today.
If you could just explain to me where heartburn comes into the whole topic.
Okay. All right.
Okay. Because so many people have this as problem as well, as the ulcers, heartburn.
Okay. Now, what the problem with heartburn? This is what happens. Remember, the heartburn is still as a problem of acid that actually regurgitates, that goes back, into your esophageal area. Now, remember, the acid that we're talking about that breaks down the hydrochloric acid, gastric, that acid is meant to stay in your stomach, because that's where its function is. And the way we are created, our digestive system, is we've got valves. We've got a valve up in the stomach, which is called lower esophageal sphincter. And then we've got a valve at the end of the stomach, which is called pyloric valve. Now, those valves have got to remain closed and only open when it's necessary. Now, the lower esophageal sphincter opens when you're eating, because food must go down. Once you finish eating, it closes properly. That's why you find you may feed a baby where you find all the organs are still in their optimum functioning level. You may feed a baby and you may play with the baby and turn the head upside down, but you won't find that baby, vomiting, and because the valve closes properly. It's still new. But now what happens is, with all the problems of constipation, particularly constipation causes, because you must remember, when you're constipated, the colon goes up. You've got an ascending colon, there's a transverse, and there's a descending. Now the valve is actually where your transverse colon goes through. So you see it's sitting right above, just above your transverse colon. So now when you are constipating, remember, when you're constipated, that colon is brought forth. It's packed. It's like a really stuffed sausage. And what happens is, because of, and you must remember, the colon is not just a straight tube like this. It's got gorges like this. Yeah, it's got pockets. Now what happens is when you're constipated and that colon is packed, it will even fill up those pockets, those pouches, and such that the poo will push up the valve so that it does not close properly. And then acid will start to go up then you start having refluxes because your valve is not closing properly. So that's how the acid starts to escape. And when it's escaping, then it burns you. It gives you that heartburn, because it's not meant to go up there. It's meant to stay in that stomach. So, but because of that problems with your lower esophageal sphincter, and then it starts to escape, and then it gives you a heartburn. And that is actually not good, because remember, acid is corrosive. It eats on those tissues. And at least in the stomach, if there's nothing that has damaged the mucous lining, you find that acid is okay there. But once it starts going up, it eats on those tissues, and those are soft tissues. Then that's why you find people with heartburn eventually end up having esophageal cancer, because it really is corrosive and it eats away those tissues. So that's bad.
I got so used to it over the years. I mean, we've all been witness to this all the time. But just getting back now, you're raising more questions in my mind as you're going along. So the link between stomach cancer and esophageal cancer?
Oh yeah, definitely.
Part and parcel.
Definitely, because like I say, acid is meant to remain where God has naturally provided for it. Because like I say, the stomach lining of the stomach is very well protected against the acid. But that acid has got to remain very, very acidic. So when it escapes or goes through that mucus lining, and gets to your stomach, it's gonna eat away. Where it eats, it damages, yeah. And then you eventually end up having cancer, or in esophagus, you find that it will cause you, because it eats. You need to avoid at all costs to have acid getting in touch with your soft tissues. Acid must remain where it's supposed to be, and then you don't have problems.
But it's amazing. Every time you're talking about this, the lining being so sensitive, I think of, like, we all eat tripe, and you look at the thickness of the tripe, and the little, almost little bits of, what would you put it, little pockets that is inside the tummy. I mean, it's a thick membrane. And you think of the esophageal one going up, which is thin and delicate, which is basically, really not designed
to push down food, not to deal with acid burn.
Also, when you say acid, it actually makes me just think of a bit of humor. Don't get the acid on your skin, it's going to burn you. But it's fine for you to be in your throat and esophagus, which are the most probably delicate tissues of our whole bodies, our throats. Absolutely.
Exactly. Then you start to, and people, and the thing is, it takes long for the body to eventually succumb. Remember, your body is going to try and fight it and fight it and fight it, but then you end up start having a sore throat, common sore throat, and then your voice starts to become hoarse. Then you start having, when you eat certain things, you can actually feel that they're burning you, and those are signs that it's really taking a beating. It cannot handle it anymore.
Abuse.
It's
Poor bodies.
Yeah, poor
Tell me,
bodies.
how do antacids help you?
Okay. Antacids are actually not a really bad thing in that they give the relief.
Small and not permanent.
Cannot count on them to be your savior. Because remember, like I've said, to relieve yourself of the excruciating pain, because I know people that suffer from ulcer, they just cannot handle it. But the pain is really excruciating. So antacids in that manner, they help to relieve you of that. But while you're taking that, you need to, there are some natural antacids, because remember the ones that we're talking about, there's drug related antacids, but then you find that there are natural antacids, which are made from pure or natural herbs or even food, like slippery elm, for instance, is actually a good source of natural antacid. But now you find that when you're relying on antacids that end up messing up the pH of your hydrochloric acid, you will never really get rid of stomach ulcers. You will never, because you need to take them just to relieve you because like, for instance, when we treat it, you find we'll give you something that's going to contain the acid. But while we're containing that, we're sorting out the pH so that it goes up, because then while that is happening, this is going up, then it helps you to break up proteins. Well, then you find that a person has been suffering for years and cannot even start eating, but you find that you can actually heal them within a short space of time, because while we do supply antacids, they are not an end be all and end all. They are just part of the whole protocol of helping to heal that ulcer and then get the body to take over the function of sorting out the hydrochloric acid, and then helping you to digest the proteins properly so that they can heal that, so that you are completely rid of the problem. It's not just the ulcer, but you find that once your valve is messed up, it's not closing because of all the chronic constipation you've been having for years. You find that while you're sorting out that, the acid, you need to help that as well. That is why we've got a protocol for acid reflux, so that we keep that acid down. Because if, for instance, we help with all that, but the acid keeps on coming, you'll find that you will still have problems in the esophageal area, So that is why you find our treatment, therefore, is not just one thing. It's a protocol. It works on the affected areas, deal with source, but then combine with all the systems that are affected, so that we know we've dealt with it properly. So, antacids do help, but not an end, a be all and end all.
Yeah.
They are just a means to an end.
Temporary thing.
Temporary.
Until you get the right help.
Until you get the right formula.
Okay. Debbie, I've noticed since you've discussed the constipation issue and stomach ulcers, the demand has been astronomical. How do you plan to supply the medication for this huge demand that is happening on a daily basis?
We like we did with constipation, which seems to have triggered the request for stomach ulcers. Even stomach ulcers, they fall in the category of illnesses that we can help with in the meantime. Okay. Because like they cause a lot of pain. It's actually worse than constipation, because constipation is not painful, but it's uncomfortable.
Sure.
But ulcers are painful, because it's a sore. It's an ulcer. So we do have a program also, a package that we can give to people just to deal with that
Okay.
in the meantime. But like I've said, we need to establish, is it gastronoma? Because if it's gastronoma, you find it's going to be an ongoing thing to have to take that protocol for ulcer, even in our case, because while we're fixing that, the pancreas is going to, or your duodenum will going to keep supplying all that gastrin, oversupply of gastrin. So we give that, like I say, as a means to an end, not an end in itself. So while you're trying to get time to get to us or whatever you're planning to do, we will give you something that's just gonna correct, but which is not a permanent correction, because up until we know what is the source in your case, we will still need to deal with you better than just supplying you with that. But like I said, like we did with constipation, we're getting quite a lot of people
Absolutely.
for constipation treatment. So for ulcer, stomach ulcers, we will also we also have prepared a package that's just dealing with that up until you people get a chance to come and visit us or
That's
whatever.
fantastic. Awesome.
Yeah, all right.
Wonderful.
Thank you.
Pleasure.
All right. Okay. We hope we've answered some of the concerns, or not concerns, but questions and requests that you people send us around stomach ulcers. Thank you for sending these questions. We really appreciate them. And goodbye.
Health Haven is taking the health industry by storm. They are the talk of the town because they do the unthinkable and the unprecedented. How do you take someone in Miss Sinovillo's condition, who has been in this position for years, someone who is completely disabled, and promise to get her well again? You can only do that if you are sure of what you are doing. That is what defines Health Haven. They have the gift of healing, and they know what they are doing.
Well, that is so much about ulcers. You don't have to accept that ulcers are a way of life, as that seems to be the case with most of you. And you must not just accept that you just have to live with it and only rely on antacids. The purpose for this show is to give you information so that you can make informed decisions about your health. And I hope this portion about stomach ulcers has enlightened you a bit and will help you to do something better other than just rely on antacids.
Health Haven is taking the health industry by storm. They are the talk of the town because they do the unthinkable and the unprecedented. How do you take someone in Miss Sinovillo's condition, who has been in this position for years, someone who is completely disabled, and promise to get her well again? You can only do that if you are sure of what you are doing. That is what defines Health Haven. They have the gift of healing, and they know what they are doing.
Welcome back. We are now getting to the session where we ask or where we answer your questions that you send to us via your emails. As usual, we've got people from Health Haven on my right. I've got Tobeka Spielman, and on my left, in fact, they're both on my right. Okay. I've got Tobeka Spielman, and I've got Kelly Atterbury. Hello, ladies.
Hello.
Okay, can you please ask the questions?
I suffer from chronic constipation, and a friend of mine once told me about colon irrigation. Does your clinic offer that, and would you recommend it?
We don't. Okay, maybe before I even answer if we offer it or not, just to tell people what colon irrigation is. Colon irrigation is a procedure that uses water to flush out whatever's clogged in your colon. It's actually quite a useful procedure, but it it does work to some extent, but for it to work very well, you've got to be able to break down the hardness of the stools. We don't offer it ourselves, but we do have a company that offers it, where we sometimes refer people that have got very, very serious constipation, maybe those that stay for about 3 to 4 weeks without relieving themselves at all. Now, what happens is, one thing that we know, that we have established with a fair amount of consistency, is people who just go for colon irrigation without breaking down the stools first, that is softening the stools. It's not very effective, because you must understand that those stools, for people that have had such a serious constipation, they really harden like stones. They really are like stones. And you cannot just, and you must remember, colon irrigation is just water. It's just that it's a lot of water, and it's got a suction power. It actually it sucks out the stools, and but if the stools are hard enough, colon irrigation doesn't work very well. So you've got to do it over and over and over again. But even then, you find it doesn't work very well. But where we have first prepared people, where we put them on a 3-day program or on a 7-day program, where we first work on those stools, you find it works extremely, extremely well. But I recommend it because it's actually quite a useful procedure. But like I say, you have to break down those stools before you flush them out. Otherwise, it is a good procedure. We don't offer it ourselves, but there is a company that we normally refer to when we have cases like that.
I was diagnosed with colon cancer, and the doctors operated on me. I now have a stoma. My stomach feels like it is burning all the time, and I am desperate for help. Can you help me?
Okay. Like I warned earlier on about the seriousness of constipation. Once the complications of constipation are stomach cancer, colon cancer, like this client has already indicated. And now a stoma is, once the colon, and this happens in most cases where you find that colon cancer, because you must remember the colon has got an ascending, a transverse, and a descending section, which leads to the rectum. So once the colon cancer affects the colon to such an extent, becomes a colorectal, which means it's not just the colon, the rectum is affected as well. So it becomes a big problem to relieve the stools through the rectum. You find that they will operate on you and cut your colon so that you don't use your rectum to relieve yourself. You actually relieve yourself through they actually make, that's why you find people have got that stoma. That means they relieve themselves through that bag, because the colon is actually separated from the rectum, or from the descending one. Now, once it gets to that stage, it is quite challenging. And the reason why you find that person is feeling such a huge burning sensation in the stomach, it's because you must understand that cancer thrives on an acidic environment, and it actually creates the environment, the acidic environment itself, because that's how it thrives on. So the burning sensation that this person is feeling is the acidic environment. But once it becomes a stoma, once you have a stoma, it becomes quite challenging. Although we've treated a few people with a condition like that, with stomas, but now this is where the challenge is. When we treat people, cancer patients, you find that we work very hard to restore the alkalinity of your bloodstream and of your body, which means we change your body from being too acidic but to being alkaline. Because once you do that, cancer does not thrive or does not survive on an alkaline environment. That is why you find it creates an acidic environment. So we change your pH to that of being alkaline, and we get rid of that acid. But now we must understand, once we get rid of that acid, we must actually get it out of your system, such that you'll find a person will say, my rectum is like burning because of the stuff that comes out. You can actually experience the burning in your rectum because, the amount of acid that we get out of your system. But now you must understand that the rectum can handle the type of beating that it receives from servicing the body and eliminating. That's why you find the tissues of the rectum are actually quite strong. But once you have a stoma, all that stuff has got to come through that opening that is created through your colon and through your stomach, and that is actually too challenging for the skin around your stomach, because remember, that stuff is burning. Like you feel the burning inside your stomach, the stuff that comes out is actually as acidic as that. So, but your rectum can handle that. But when it's a stoma, you find that it becomes quite challenging because the skin around your stomach is actually put under a lot of pressure to have to deal with that level of acid that comes out of your system. So you find that while we do that, we need to keep on working on the skin around around your stoma to make sure that it can manage. So it's not as easy as when the person has got is relieving himself through the rectum, but we've done it. We've done it in the past. It's actually doable, but that's just the challenge that we know we always encounter when a person has got a stoma. Okay.
I suffer from a serious shortness of breath, and the doctors say my heart is giving in. They are even considering doing a heart transplant, and I am scared of this. Is there anything you can do to help?
Shortness of breath is a condition that is caused by a number of problems. Okay. The heart may be one of those, but what I don't understand is the fact that of course there is not enough explanation that gives us an indication of what is happening really in the heart. And even though you are on treatment, you find that heart seems to be giving in anyway. It's getting worse and worse and worse. Now, there is something that I have established in a few cases that are cardiac cases, but that come to us. And I'm thinking of two particular cases where these people had a serious problem of shortness of breath, and the heart was also affected. But the problem was not emanating from the heart. So even if the heart transplant were to end up being carried out in a case like that, you find that even the next heart that you'll be given, it will still deteriorate, because the problem is not coming from the heart, is coming from another source, but is affecting the heart. So two cases that I can think of, which I know fall in this category, where a condition that comes from mediastinal area. Now the mediastinum is the area around your chest. It separates the lungs from your chest. So now people that these two cases that I know of, these people had what is called mediastinal tumors. Now those tumors were developing right around in the mediastinum sternal area, and one of the tumors in one case was actually even sitting on the trachea, which is the passage that carries oxygen into your bronchial tubes and into your lungs. So there was the one that was sitting in the trachea, and there was one and there was one in the heart. Now, besides the mediastinal area, the tumors had developed to such an extent that the one in the trachea and the one that was even blocking the proper flow into the heart. So those were the reasons why this person was suffering so much from shortness of breath, such that one of them was actually using a portable oxygen supplier. Now, in such cases, when it is not the heart that is causing such a serious shortness of breath, but it is like your mediastinal tumors, even if you do get a heart transplant, that heart that is replacing this other one, you will find it's going to deteriorate as well. So it's always important to know why does it cause so much shortness of breath, irrespective of the fact that you're getting treatment. So that is why, therefore, I'm saying, and in these two people's cases, that heart was struggling because it was battling to get a good supply of oxygen, not because in itself there was a serious damage in it, but it was just that it's not getting the oxygen because of the obstruction that was done by this mediastinal tumor. So in such cases, therefore, you will not fix the problem by just doing a heart transplant. But in any case, like we've always said, these are very delicate cases of diagnosis, which are quite involved, and it's important to know which one it is, because in case of mediastinal tumors, we've got a treatment that can actually shrink those tumors and open the flow of oxygen so that your heart receives it, and therefore you find that the shortness of breath actually improves. So in cases like we've always said, cases like that or like any other case, we always encourage people to come so that we can scan them, because remember, our diagnostic techniques are in a position to detect specifically and accurately to see where the problem lies, so that you will treat accordingly, according to what the diagnosis is actually showing. So that is what I would suggest. So even in these cases, like we always say, you just need to come to our clinic so that we can scan and see what is the case in your situation.
I am a 36-year-old female. I come from a family of breast cancer. I do a breast examination every year and also a mammogram every year. I have a tingling feeling on my left breast, but tests come out clear. Is it possible that the test can fail to detect cancer at an early stage? This is my fear. Can you help me?
I mean, there are many cases that I know of, and where people, particularly for people who come from a history of cancer in their family. I can think of one case in particular where this lady was doing mammogram every year. In fact, she was doing it every 6 months. And when she came here, she was convinced that there was nothing with her breast. In fact, when she came for the scanning, she didn't tell me that she was doing mammogram. She just came because someone had recommended that she must come here. So when I tested her, I actually picked up that she had cancer on one breast. And when I told her that I'm picking up this, she was actually quite annoyed with me. And but on talking to her, because she actually did not even believe what my diagnosis was. But when we were discussing about it, she told me that her sister died of breast cancer. And even though she did not accept in her case, but her sister died of breast cancer. But she didn't accept that she did have a breast cancer herself. And she left without accepting my diagnosis. But the interesting thing is that she came months. I think it was, I didn't even recognize it, but she came a couple of months after that, and she had actually removed her breast. And she was just coming to, just to vent, because she was shocked that even though she had been doing the mammogram so frequently, that they could miss it. And she was just coming to apologize to me because I had actually picked it up, that she never accepted my diagnosis. So what I'm getting at therefore is, it happens most of the time that you will go for mammogram, and I think maybe the mammogram of the conventional medical techniques tend to detect something too late. It looks like when it's still at an early stage or maybe average stage, they tend to miss it, and they only pick it up when it is quite a bit late. So the fact that you're feeling a tingling feeling already, to me, is an indication that there is something in that breast, because you will not just feel the tingling for no apparent reason. So that is already indicating to me that there is something in that breast. But as I always say, we'll be able to tell you if there is something and what is, because sometimes you may feel something in your breast and yet it's not cancer, because even fibrocystic breasts, you may experience something if you've got a problem of fibrocystic breast. So we'll be able to tell you if it is cancer or if it is something else other than cancer. But like I say, you are justified in having such fears. It happens all the time. So I can only encourage you to come and see us, and we'll be able to tell you. Okay. Is that it? Okay. Thank you, ladies. Thank you very much for your questions. Goodbye.
Health Haven is taking the health industry by storm. They are the talk of the town because they do the unthinkable and the unprecedented. How do you take someone in Miss Sinovuyo's condition, who has been in this position for years, someone who is completely disabled, and promise to get her well again? You can only do that if you are sure of what you are doing. That is what defines Health Haven. They have the gift of healing, and they know what they are doing.
One wise person once said, "Instant gratification is so deceiving." That means the pleasure that you experience now by taking or doing something that is bad for your health becomes completely forgotten when you experience the pain that goes with that decision at a later stage. And many people are paying the price for bad decisions that are made earlier in their lives, and which they were aware was not to their advantage. It is understandable when you don't know that you're actually doing something wrong that will harm your health. But now that you know, this is a time for you to make good choices about your health. And enjoy, and goodbye.